2017 World Bank statistics show that the total expenditure on health in Nigeria was about 3.8% of the gross domestic product. This brings the value to about 14.28 billion US dollars. Conversely, in South Africa, with less than a third of Nigeria's population, of about 190 million at the time, the health expenditure was 8.1% at 28.3 billion US dollars. Meanwhile, donations alone to fight COVID-19, most from private concerns, topped 25 billion naira.
I would say that it's a little bit premature to actually be able to determine exactly how much the whole health sector has lost to COVID-19 because we are still in the midst of trying to solve the problem at the moment.
First quarter is gone and people may not be able to recover. The drop in sales that the pharmaceutical industry experienced within this period will not be less than 20 to 25%. 20 to 25%. So you will be talking in terms of 200 to 300 million, US dollar that must have been lost.
Realizing the deficit of care that existed in the system, the federal government declared it would make 10,000 primary healthcare centers functional by 2017.
I'm not aware that anyone has been done by the federal government. The only one I'm aware is that some have been renovated by the local government, by the PAC board, and some people that are doing private partnership with the Lagos State government. If our primary health care system is functioning very well, we don't have the problem. In the sense that the level of awareness, the level of the health education should have been done at the level of the primary health care before you have this transmission, before you have the community transmission.
Over the years, doctors and other health workers in Nigeria have agitated for better pay, more standard equipment and training. Dissatisfied with government's response to their demands, many had relocated to other countries for a larger pay packet and better working conditions, resulting in a very poor doctor-to-patient ratio of 1 to approximately 3,000. Those who remained went on frequent strikes. On top of all this, Nigerians woke to a Lassa fever outbreak in 2020. This was the prevailing condition when, on February the 27th, 2020, the first case of COVID-19 was detected in Lagos. Only one isolation center existed for COVID-19 in the infectious disease hospital at Yaba, and 5 labs had testing capacity, testing and verifying samples of hundreds of contacts of COVID-19 patients, plus treatment of other ailments in regular hospital business, stretched staff and resources thin. The virulent droplet disease did not leave health workers unscathed. By May the 5th, about 150 doctors and health workers had tested positive to COVID-19. In a paper released on April the 24th, the Nigerian Medical Association lamented the death of 3 doctors and a nurse due to COVID-19 related causes from treating VIPs who refused to be admitted in accredited centers. It resulted in the temporary closure of several private hospitals which were exposed to the disease. The government addressed the deficit of workers with non-stop training of volunteers, and isolation centers were set up in almost every state nationwide. In a matter of weeks, more COVID-19 test labs sprang up in different states. There is no doubt that states have made an effort to combat the novel coronavirus disease, but more could have been done if the disease had met a stronger health sector. Sensitization continues, with health officials insisting on social and physical distancing, respiratory hygiene, hand washing, and cleaning of often touched surfaces, with the hope that in no distant time, transmission will be broken, leaving behind a health system strengthened in infection prevention and control. Mary Alale Yusuf, Channels Television News.